Assalamu alaikum wa rahmatullah. We're back here again. I think we're on episode 9 of this podcast. Alhamdulillah. And today,
mashallah,
I'm your host. I've got Mawlana Khabab as a co-host, and I've got Dr Abdul Wajid, who's a clinical and forensics psychologist,
yes,
and has been in the practice for 15 years. So, assalamu alaikum to you.
Wa alaikum assalam.
How are you today?
Alhamdulillah. No, jazakallah khair for inviting me on, mashallah, and just having a bit of time to look at some important issues facing our community.
mashallah. So, Brother Abdul Wajid, mashallah, we've known you for a long time, mashallah. I've seen, we've grown up together, kind of thing. Well, yeah.
Oh, okay.
Just
He
opposite.
left that bit out actually originally. I did notice that at the beginning. He missed out the bit that he's been our neighbour. Their family been our neighbour.
Neighbours.
Yeah, my children used to stay at their house.
Mashallah. So, Brother Abdul Wajid, if you could just give us an introduction of the work that you have been doing in the last 10-15 years.
So yeah, so as the brother introduced me, I'm a clinical and forensic psychologist.
Mm-hmm.
Mashallah, sounds really fancy.
Sure.
And alhamdulillah, by the grace and mercy of Allah subhanahu wa ta'ala, Allah has allowed me through the gift and the knowledge and so forth to be able to work in this important field, because there aren't that many people actually working in such fields who are both grounded inshallah in deen and then also in the clinical aspects. So alhamdulillah, I've been utilized in this environment for up to about 15 years, and then including my training a bit longer. The work I normally get involved with is often working with individuals who are facing a range of challenges, mental health challenges, from simple anxiety, depression, isolation to more extreme forms of challenging behavior where could be psychosis to long-term mental illness, to trauma or PTSD, and the vast range of activities along that. So each of these is different types of illness. So when we talk about mental illness, it's not just one thing, or mental well-being is a whole branch of things that encompass many different aspects of mental health. And
so you were mentioning that not many people are into this type of field, who are both.
Yes.
Yeah.
Well,
so you think there's a big...
Yeah, just to clarify, sorry, yeah. For about 6 years, I was the only male Muslim psychologist working locally in the trust for 6 or 7
So do you think there's a huge demand?
There is a demand, but alhamdulillah, over the years, mashallah, we've seen a lot of young people and a lot of Muslim young people come through, male and female come through the system and everything. So just for those brothers and sisters who are interested in a career within clinical or forensic psychology or counselling psychology, just to add that it is a long slog. It is a long slog. So you've got everyone does a degree in psychology, like the
bachelor's degree.
Yeah, it's like the flavour of the month type degree and everything. And then what you've got to remember is that doesn't necessarily mean you're a psychologist or a counsellor or anything like that. What you've got to do is you've got to do a series of postgraduate training activities.
Continue.
So you end up doing a master's or a PhD, and then that's still not enough.
Okay.
You've still on top of that got to do training.
Some training, yeah.
You've then got to do you start off at the bottom of the ladder as an assistant psychologist or a volunteer and things like that. And so it is a long slog. So just to caveat what I was saying about why there aren't that many people doing this role is because actually it is incredibly difficult. On a practical level it's difficult, but on an educational level it's difficult because to get into the courses is very competitive and challenging.
As in by grades, you mean?
Yeah, in grades and also the number of places as well, because to qualify as a psychologist, you have to do a doctorate of psychology, and so it's like a PhD type skills course, and there are only like 20 places in Leeds University, for instance, that does it, or Sheffield does it, there's about 20 to 30 places, and there's usually about 10,000 people applying for these places and what have you. So what these places are training contracts, so you get placed in the NHS and there's training and things like that available.
So how many years would it take for a person to be actually considered on this role? So 3 years for bachelor's, then a master's and a PhD. So we're looking at 6-7 years?
6-7 years, and then not including any
training
that you might do either concurrently, or you might want to do, like, you end up either volunteering or working in the psychology department. So that's 2-3 years already on top of that. So it's a minimum of 10 years.
10 years.
So that's why for a long time. But there are, mashallah, slightly quicker routes. And I know I'm conscious that this ain't probably the full topic of the area that you want to talk about.
No, it's fine.
But it's really important to highlight, actually, because a lot of youngsters
like how hard
it is
for you to
get.
Yeah.
Mashallah.
And I think it's important to realise that often a lot of youngsters in our communities do psychology.
True.
Male and female, they do psychology, but then get stuck at what they can do after that and what have you. But there is, going back to what you said, there is a clear need, because actually, mental health, mental well-being, and the challenges our community face are particular, and often the services that are available are often mismatched to the needs that we have as a community. So what I mean by that, I started my training in psychology in 2004, so I did a report in 2004 working in Dewsbury Hospital, actually, that if you look at the people coming into psychology, Muslim people, Asian Muslim people particularly, only 1% were coming into psychology at that time. Now our population has grown, and our population in Dewsbury Batley, statistically, just basically on numbers, is that actually, on average you would expect at least 2 to 3% people accessing psychological therapies at that time, but less than 1% were. And then when they do access the psychology support, they actually disengage with the support. So I did a little report saying, actually, what's going on here? What are the issues facing Muslims, and why don't they engage in psychology? And what are the challenges? And what was happening, though, was actually they don't engage in psychological support, but they do end up coming into our inpatient units. So when a black person or a Muslim or an Asian person comes into our inpatient facilities, they end up staying longer, they end up coming at crisis point. So when the issue or the challenge that they're facing has got to such a
boiling point,
high end,
you're just on the verge of breaking.
When they're on the verge of breaking down, and they've been sectioned, so they've been detained in our inpatient unit.
Sometimes it could be a bit too late.
It's too late to help them, so they then end up being stuck in our systems longer. They end up with quite a lot of drug treatments and what have you. So the point I'm making, actually, in 2004, this was the issue. Actually, we did a repeat of that evaluation in 2019. It was exactly the same scenario. If you're black or Asian, you end up coming into our facilities longer, and you get diagnosis a lot longer and detained longer.
So 15 years and no difference?
No difference. Even though, there was core psychology services at the time, but then something else came along called IAPT, and now it's called talking therapies. And the idea of IAPT was that people with low and moderate symptoms, so something that was niggling at you at the back, you could just access some support. So Asian people are accessing support.
But it's too late.
Well, actually, for IAPT, no, it's not too late. But actually, the support they're accessing is still not helping them sometimes.
Right. So is that something with the patient that's wrong, or something with the support? What's
a bit of both. A bit of both. I, in my personal opinion, I would say it's a bit of both, because the challenge with the patients are that in our community, often we're looking for quick fixes. We're looking for things which will
instant,
rectify the issue straight away. Oh, I feel ill. I need a tablet. I need something to change my circumstances. I used to call it the magic bullet, but actually that's not what actually mental health and well-being is about. And then in the services side, the way the services are set up at the moment is that there's a lot of guided self-help. There's a lot of actually, if it's low or moderate anxiety or depression or challenges you're facing, you can then, deal with it yourself basically with a bit of guidance from the health professionals and what have you. So the services aren't configured.
This will just get into. You look like a professional, a very big person in this kind of field.
Not really, but yeah.
But no, in terms of access, so if let's say I'm going to a GP, that's the first point of contact I would do. What would I need to do to get in touch with you or a person like you?
So
you'll get referred, no?
Yeah, absolutely, man.
But what I'm saying is, how severe does my illness have to be where I have to get referred to you?
Yeah, so your GP will assess you.
Okay.
Yeah, or will refer you to be assessed. Yeah.
Okay.
There's also, so with talking therapies and IAPT, what was called IAPT, sorry, you can self-refer.
Okay.
So you can just ring up and say, actually, I'm not feeling well. And I think just a step behind, sorry, we've gone into quite a protracted conversation, but just a step behind to define what mental illness is and what, mental health and well-being is, I suppose. A mental illness is when, everyone feels happy, sad, whatever. Everyone will have challenges,
Different emotions up and down.
Life is full of challenges. So it's not that you want to always be happy. It's not that you will always be sad. But actually the problem occurs when that emotion or that feeling or that issue stays with you for a protracted time period, and you can't shift it, and you don't know what's happening.
How long is a protracted time? What would you consider?
It depends on the nature of the issue.
Right, okay.
Yeah, it depends on the nature of the issue. So say for instance, you're stressed about your exams and everything, and that stress is making you anxious, it's giving you headaches, tummy cramps, it's making you feel dizzy, you're getting hot, sweaty, whatever. These are just generalized symptoms that people might get when they're feeling anxious. That then, once your exams are finished, you might still have residual anxiety because you still think whether I've done well or not and what have you. That's normal.
Normal.
That's normal. But say for instance you're still waking up 2-3 weeks later, just as an example, 2-3 weeks later you're still waking up in hot cold sweats, you're panicking, your breathlessness and things like that. So that is where you might need to seek help or guidance on, because actually
it's getting too long now.
The symptoms that you're experiencing are with you for a slightly longer period than what the normal stressor was. So it really, that's just a really wide example I've just given you, and I've just tried to give you some examples of symptomology as well, so the symptoms that occur in people when they're feeling a bit anxious and everything. But the challenge is that if you're feeling those symptoms for a long time and you can't shift them, but also you don't know why you're feeling them, and then that's making you feel even more rubbish, and it's feeding into that anxiety. It's always useful to go talk to somebody. It's always useful to seek help, seek advice and support. And that's what IAPT is about. IAPT, or talking therapies, is about giving you that initial guidance on actually you just need to breathe. You just need to do this, you need to do that.
Sometimes you look forward, you take a step back.
Yes, absolutely.
So do you think it's growing in the Muslim community, or?
No. I think the prevalence of challenges is again, this is my opinion based on my experience and what have you. The challenges within the Muslim community are symptomatic and similar to the general public. The problem lies though, or one of the challenges, the main challenges that we have, is that people come late to access support.
Could that be because they don't believe in it?
Some is because, yeah, absolutely. There's part of the scenario that people will say, I need to go pray my namaz, I need to do this, and these bishak will help. Yeah, they will always help. Going to the Quran, turning to Allah subhanahu wa ta'ala.
Remembrance of Allah
will always help. But if you don't know what is bothering you, or if you don't know what the challenge is, how you can solve it. Yeah? So it's like you're trying to solve a jigsaw puzzle with some of the pieces missing.
I mean, there's clearly both resolution in the Quran. It mentioned in Surah 20, verse 124, where it says, if you turn away from my remembrance, you will have a depressed life or a difficult life. And Allah says also that for every illness there is a cure, and obviously talking therapy or therapies are the cure for mental illnesses. Yeah, for
specific type of illnesses. And one of the questions I'm surprised you've not asked me yet, or maybe because I'm talking too much.
No, that's why you're here for, to talk.
Maybe I'm talking too much, but one of the questions you've not asked me is, what is the difference between a psychologist and a psychiatrist?
And a counsellor.
Yeah, and a counsellor.
Because I believe you've got a degree in psychology, right?
I'm learning.
We'll talk later, yeah? So a psychiatrist firstly has to have done medicine.
Okay.
Yeah? And the psychiatrist's focus and function is the neurochemistry, the biology of the individual. So it's a very medicalized model. Yeah? It's looking at the illnesses and trying to quantify and challenge the illnesses, on a biological level. Yeah, so the psychiatrists will give you medication. They will also give you a mechanism to reflect and use a bit of talking therapies as well. But their main line of treatment is medication. Yeah, a psychologist's main line of treatment is either cognitive or behavioral changes and helping you understand the challenges you're facing. So it's not one or the other, they all complement one another, they're all part
together.
A person could go to a psychologist and a
psychiatrist at the same time. And then a counsellor. So the remit of the psychologist is very much it's thinking about your environment, your behavior, your understanding, and your interaction with these things. The counsellor is a person to reflect with. So all the other two will reflect with you as well, but actually each of them will have a hypothesis about what your challenges are and will construct a treatment plan. A counsellor will just provide you with an area of reflection, will help you try to understand your perspective and what have you.
But he won't give you any advice.
Technically they're not supposed to give you advice, because it's supposed to be a sounding board, but
just like a ear,
listening. But actually, in reality,
you can.
Every man and his dog gives advice for everything.
Every person is a doctor.
Everyone becomes an expert at everything when you ask them your opinion.
You got a headache or you haven't slept well enough.
Yeah, basically everyone will give you some sort of...
There's no shortage of doctors.
Yeah, so whether you're a counsellor or whatever, everyone will give you...
It's impossible as a human.
Yeah, as humans you will always...
I feel like it's our nature too when you...
But it's just that you're not qualified to give
there's qualification, there's experience, and there's
expert opinion and just opinion.
Yeah, and one of the other things, going back to, the original question was not many people get into this role because it's complex, it's time consuming, and often it's a hard slog. But actually, in saying that, there are many now Muslim counsellors. There are many services out there for people, and religiously, there's been a bit of a movement to understand that actually tazkiyah, the whole concept of tazkiyah, which is about reflection, which is about rectification, and understanding that you're not perfect, you will make a mistake. As a human being, Allah subhanahu wa ta'ala has created you to make mistakes and challenges and what have you. That is the whole point of, I'm not sure I'm allowed to quote this, but I always, in my therapy, I always say to people, the line from Batman where he goes, why do we fall? It's to pick ourselves back up again.
I remember that one.
Yeah, so just, yeah. My therapy has a lot of analogies. No, but it's really interesting because the idea is that you will fall. You will experience.
Yeah, life has ups and downs. Yeah.
What I wanted to ask you, is how do you implement the Quran and the Sunnah for your Muslim patients?
Well, even non-Muslims, there is.
Or you non-Muslims as well?
Yeah, even non-Muslims. So, what you got to remember is depending on the nature of the challenge the person faces, there are different domains. So what I mean by domains is as a psychologist you will look at these domains. So the first domain is your biology. So I've already talked about. So there's chemicals in your body. There are systems in your body. So when somebody feels anxious, for instance, there is an automatic system that occurs in your body, and adrenaline is released in your body, neurochemicals, cortisol is released, you sort of tense up, you get stiff, and what have you. These are automatic systems in your body. The way, I know this sounds, this is a really quick and easy, dirty method in helping anyone with generalized anxiety is the thing that you need to do, which again is part of the Sunnah and what have you, is firstly breathe. I said to somebody once, all you need to do is breathe. He goes, I am bloody breathing. And I said, no, actually, you need to take a deep breath. Because actually when you're anxious and when adrenaline is released in your body, you don't actually take in oxygen. So, like the example that in school they used to give students is that anaerobic and aerobic respiration. So aerobic respiration is using oxygen, anaerobic is using adrenaline and neurochemicals, noradrenaline within your body. So what that is you're not actually using oxygen. And when you don't use oxygen in your body, it actually releases other hormones and chemicals and things like that. So your body tenses up. And again, this is all completely natural. This is how Allah subhanahu wa ta'ala has made us. So an understanding of the neurochemistry and the biology of your systems. So just to add to that, when some people get anxious, they'll get tingling feelings, they'll get hot, they'll get sweaty, they'll get stomach ache, because actually when all the chemicals are flooding your body, what does the body do with the chemicals? It dumps it in your stomach. So you get stomach cramps, you want to go toilet, you want to go for a pee or whatever, So your body's automatically reacting on a neurological level to your symptoms and what have you. So you have to understand the neurochemistry and the biology of you. The next domain is actually your understanding or your cognition, your thinking, of the situation around you. So how you think, how you perceive the world around you, and how you make sense of the world around you. So how you construct your reality. So what gives it meaning in your world. So what I mean by that is what are your value systems? What is the thing that helps you understand what is right, wrong, morals, ethics, and this is how you construct your value systems around you. So an understanding of the value systems around you, your cognition. Then there is the history, the narrative, your story, your family story, your
background.
Your background, your heritage, your narrative, your life story. So when somebody comes to a psychologist, they'll ask you, there's that meme or whatever that says actually, some guy lying on a couch and goes, tell me about your childhood. That's not far from the truth, because the idea is we need to understand your world. We need to understand your history, your narrative, what's actually
starting aggravating.
Then it is about your feelings, how you associate. So one is your cognition, and you know, if you want to go deeply into the Islamic side of it, the cognition is, the Western psychology will see the cognition specifically of the brain, so the brain is the house where your thinking patterns are made, but actually there's the feelings, so how you feel about the world around you, how you, what makes you happy, sad, angry, hurt, and how you interpret those feelings, how they make sense to you. And from an Islamic point of view, the qalb, the heart, so Imam Ghazali talks a lot about the heart.
The heart,
and actually the rectification of the heart. So Islamic theology specifically mentions the heart being the root of
everything.
Of fitra and your feelings. So you have to have an interpretation of the heart, and your feelings. And the last dimension, or one of the dimensions, sorry, no, it's not the last one. There's another one as well. I can't count. There's like the other dimension is actually around your interaction with the world around you.
How you interact with the world, or how the world interacts with you?
Both.
Okay.
Because you are separate to the world as an individual, so your thinking is unique, but actually you are part of the system and the world as well.
True. Because you are in this world.
You're part of the system and you're outside of the system at the same time. Just before I forget.
So you are in the world, but in your own world.
So the sixth dimension that you have to understand is your spirituality, your well-being. So even with a person of no religion, so when you ask me how do you bring in spirit, so spirituality and well-being is a specific component of a person's world as well. Because it's linked to your concepts of self and righteousness and ethics and morals. Because everyone has a code, whether they be Muslim or non-Muslim, everyone has a code. So as a psychologist, as a psychiatrist or whatever, as a health professional, you try to get a picture or a snapshot of all of these. And from an Islamic point of view, each of them can be linked to the Quran, Sunnah and what have you.
So, in the Muslim community, this is just opening another a lot of things, a lot of issues are just pushed under the carpet, saying that somebody does something to you, jadoo, all that. So do you think a lot of it is just mental health? Like not long ago,
the evil eye as well.
Like not long ago, I think a few weeks ago, I got a call from somebody. Said, "Oh, can somebody come now?" It was like nearly 12 o'clock in the night. Said, "Can somebody come to our house now and read some Quran?" Or one of the teenagers like said some things must have happened to them. So I said, "Look, I don't do this kind of things personally. Just make it clear, because if anybody thinks that, if anybody wants to." but then later on I found out from some other people that it's actually stress issues or some some other issues. It's not actually. Then they got to the bottom of it that it wasn't anything to do with it. So what I feel is Muslim community is very, very quick in trying to just blame everything on these kind of things. Maybe to a certain degree it is like the type of world we are living in, where everybody's got social media, and I don't know if you are into this social media type of world, but personally I feel, I don't know how you feel, that this whole social media is just there to show off. Look where I'm going, what I have, where I'm going shopping, what I'm eating.
I agree.
And sometimes people, they don't even have what it's as if they're just going for holiday just to take photos. They're just going to eat just to show the people on the thing. Now, if you see other people, you're going to get stressed. Oh, look where he's going, look what so people always want to have that type of show, that I want to maintain that type of standard or something. If I'm going below that, I'm going to get, So that's a type of issue with a lot of parents are dealing with, especially with teenagers at this moment in time. Where I don't know.
What is it called? Fear of missing out. FOMO.
FOMO. Fear of missing out on events or such and such.
Fear of missing out. And no, absolutely. I mean, just to go back to your earlier point about black magic, jinn, and possession and what have you, I can understand it, because actually, when nothing else makes sense in your world, when you don't know what's happening, you don't know actually, your biology's changed suddenly, your feelings and your thought process has changed, and you're trying to make sense of it, but you can't make sense of it. So the only thing that you can turn to is, it must be black magic, it must be jinn, it must be this, it must be that. Yeah.
There's no scientific explanation for it. It must be something else.
Exactly, because it doesn't make sense. Because your world has just been turned upside down.
Yeah, but that's what we need to understand, that.
And absolutely.
It could be. No, it's not always.
Right now, Maulana just said, like, it was stress related at the end that he found out. So isn't that also comes into perception, like you mentioned, how they perceive their world and how another person perceives how what happened to them?
Absolutely. I mean, I'm not an expert. You know, I did a talk once, and somebody on Ikra TV, we did a series of slots, and myself and another doctor, mashallah, he's a psychiatrist, and he could speak Urdu, I couldn't speak Urdu, so he did the Urdu bits, and we were talking about jinn and possession, and somebody rang up and said, "Oh, you guys are not Muslims because you're denying the existence of God, you're saying that everything can be rationally explained." And I said, no. Every case that I've had so far, that, you know, whether it be Muslim and even non-Muslims, by the way, I would never say to them, I don't deny their experience or whatever, because that's not I'm not a judge of their world.
True.
This is not me saying you should feel like this or you should do this, because that is not the role that a psychologist or a health professional needs to have. What we are saying to them is that you're trying to make sense of your world, and if you believe that this is something that's affecting you, why do you believe it? So you get them to look at it from different perspectives.
True.
To look at the problem as a solution.
Yes, because you know, the fundamental Islamic notion is that actually Allah subhanahu wa ta'ala is putting you through trial tribulation to help you grow as an individual. To
problems come to make you better.
To help you. Growth is painful. Growth is painful. Growth is hard. Change and growth is hard. It never comes easy, and it will always bring with it joy afterwards. But actually going through that process, you know, sometimes it might work, sometimes it doesn't, and sometimes, you know. So when our world is shaken, it throws all these questions. And the first thing we do is trying to make sense of it. Is that actually we say, oh, it's got to be something external to us. So just and one thing I want to say also is it's really important to understand that actually, if somebody's saying they're feeling jinn or this, that, and the other, our Aqidah tells us that these things exist. Our Aqidah tells us these things exist, and but actually they exist within systems.
True.
Because Allah subhanahu wa ta'ala has created a world of systems.
True.
So causality, again, thinking about science, we're in a school and everything, thinking about matter cannot be created nor destroyed. So the rule of science
can be changed.
So you know, everything moves from one thing to another. And this is a gift. That understanding is a gift from Allah subhanahu wa ta'ala. So that you understand the world around you. So the jinn and the black magic all are have their position and rules.
The old world. Alhamdulillah Rabbil Alameen.
So there are rules. So it can't just magically just happen like that. What have you. But at the same time, I'll be honest, in my entire career, I've worked with many hundreds and hundreds of families and what have you, done many consultations, and till this day I've never found one that I thought, you know, actually hang a minute. But, you know, it's interesting, we all get calls like what you did that day. Somebody rings you up and says, right, I need somebody to come and pray Quran. Somebody rang me up actually a couple of weeks ago and said, oh look, my so-and-so is really upset, and, you know, he or she is doing this and this.
Mm.
I need you to ring Maulana Sahib to come and give us some wazifa and prayer. And I said, well, why don't you do it?
Subhanallah.
So why don't you do it? What is there
something lacking in you that you can't do it?
That you can't do it.
Like just today, one guy was telling me in the morning, he was saying that until, for a child who can't read himself, then of course you read on them and you blow. But every person should read themselves, because at the end of the day, the other person, what his nature is, what he's going through, if he reads and then he blows on you, some effects of that could come on you as well.
Absolutely.
So he was just saying that I've told all my family to read their own. I said, look, anybody's got a headache, anybody's got some other issues, you want to take the medicine or you want to read, do your own reading. These are the du'as to read, these are the things to read.
I believe also, like this one person he mentioned, there's no such thing as alim in the Quran. It's just that you have to seek your own knowledge. Every Muslim's responsibility is to learn knowledge, seek knowledge, and to better themselves as Muslims. It's not that, call this guy and let him help my problem. No, you find out yourself what's wrong with you and fix it yourself, because you are capable enough as a Muslim.
Like I normally give the example that, if we every day we need to brush our teeth, every day we need to, wash our face, we need to have a shower every now and then, things like this. If we don't brush our teeth for a few days, we're gonna have issues. If we don't clean ourselves for a few days, we're gonna have issues. Yeah. So this is just physical body. Now similarly with our spiritual body, if we're not gonna remember Allah for so many days, it's gonna have issues. If we're gonna continue committing sins, it's gonna have issues. If you don't clean that body, the spiritual side, and so after about 20 days of not brushing your teeth, your teeth starts, breaking out,
Cavity.
and things like that, and then you start saying that, somebody's done something to me, or why is this happening to me? It's your own negligence. So similarly, spirituality as well, your own negligence, is all that has just added up. So our problem is that Allah mentioned in the Quran that when a person has problems, that he makes long dua to Allah. Sometimes you see a person, he says, can you give me some dua, I'm going through this, I'm going through this. When the problem goes away, then he forgets Allah. He thinks that I don't need Allah anymore. He said, when like a person, when you see somebody who's going through some problem, to help him out, you get him a house for him, he doesn't have a house, you get a job for him. After 10 years, you see him, and you think that he might look, he said, who are you? She said, you do that with Allah. He said, but the first people to be called to Jannah on the day of Qiyamah are those people who remember Allah in all conditions, whether they are going through good times, difficult times, whether sometimes you really want to remember Allah, you really want to perform salah, you really want to do it, and you do it, mashallah, it's good. But sometimes you just don't feel like doing it. You wake up in the morning, you feel really down, you don't feel like doing salah, you don't feel like it, but you still do it. No, because you're not doing it for your feeling, you're doing it for your Allah. See, all the conditions. So we need to just stay ourselves strong with our connection with Allah. Just one person, he was telling me, one sheikh, I don't know if I should mention his name, he's passed away now, Mufti Zarwali, he was mentioning, he said, he used to talk a lot about jinns. Yes, he said jinns. They started, one day they started having a go at me, they say, you're always talking bad things about us and all that. So I said, well, you guys are like that. Yeah. So then he said, today we're going to sort you out. So he said, don't worry, we'll see what you can sort. So he said, I started reading Ayatul Kursi. So I read it once. I continued reading 3 times. Then they said, your Ayatul Kursi is not going to work with us today. So he said, he continued reading. He read about 50 times. He read it 100 times. The jinn, they said, please stop reading, please stop reading. He said, he read it 300 times. He said, after that, he's never had any issue with the jinn. He said, if I continue reading even more than 300, he said, Allah has given us Quran.
Yeah.
Allah has given us
There's
Quran.
laws, there's rules. Yeah. And I suppose goes back to what you just said, that actually, as an individual, we are Allah's viceroys on this world. So after the Prophet ﷺ, we are Allah's agents in this world, and it's about understanding what that role is.
Yeah, true.
And And one other thing I suppose I need to say is we're talking about mental health and well-being in its broadest sense, yeah.
Very broad. That's
very broad.
Sense, because there are things like if people have had trauma or abuse or physical sexual abuse, and if there are challenges beyond those, it's not the same as okay, go read the Quran or wherever. There's
sometimes a person can never overcome it.
There's got to be I suppose my pushback on that would be is actually you grow. Trauma isn't something that you need to pack away and forget. Trauma is something that it helps you grow and shapes the world that you're in now.
I've listened to two opinions. I don't know which one you agree with more. Is that either you heal, or the second thing is that you learn to deal with it?
It's a bit of both, because your healing will come through your recognition that you are not
of your world.
Like this one example was like when a parent loses a child, that pain is unbearable. That'll be with them for their whole life. So will that parent heal, or will that parent learn to handle their emotions?
You would hope, inshallah, that parent will feel the pain in the days that it needs to be felt. Yeah. And then actually recognize. So thinking about the domains I mentioned. The 6 domains that I mentioned. It's helping that individual recognize in each of those domains what that pain and what that feeling of healing is required in those domains. What effect will it have in each of those domains? So there's that spiritual domain that, because that will help the individual heal and recognize that person, like, we're talking about the example you've gave, the loss of a child, recognizing that child is now at peace, is in Jannah, it'll be their way of going to Jannah as well, inshallah. So you have a boundaried religious and spiritual element, which will then reinforce how you're thinking about it and how you're feeling.
Change your perception.
It will help you manage. So trauma is hard. Historically, trauma often, people used to say, right, you just need to get over it, or you need to pack it away and forget it.
Yeah.
Actually, none of those scenarios work. So the two options you gave was heal or
learn to deal with it.
And I've sort of said a bit of both, because by healing you will learn to deal with it automatically. Yeah, you will grow to understand that your world and your perception, Allah subhanahu wa ta'ala has opened a different door. Yeah, when somebody gets cancer,
one door closes, many doors opens.
Physical health symptom and what have you, you don't think, right, I need to just close the door, forget about it. No, you deal with it, and you then deal with it through the lens that you see the world then. So if you've got cancer, it makes you revalue, the things around you. Yeah?
Which actually mean.
Yeah, which gives it a different sense of meaning and that.
SubhanAllah. Just as you were speaking, that when some person goes through some type of loss, and then sometimes certain days they remember it, etc. One hadith of the Prophet ﷺ comes to mind, which is narrated by his grandson Hussein radiallahu anh. Hussein radiallahu anh, when the Prophet ﷺ passed away, he was only 6 years old, and he has narrated 4 hadith to us. A 6-year-old is narrating 4 hadith to us. So one of the hadith is that a person who went through certain problem in his life, and then alhamdulillah he managed to overcome it. 5 years later, 10 years later, 20 years later, he remembered, oh, that happened to me, I lost this at that time, I went through this problem, life became difficult for me for a few days or for a few months. And as well as he remembers that, just that flash of history back, he just says, Inna lillahi wa inna ilayhi raji'un. The reward Allah gave him then, Allah will give him the same reward again.
Subhanallah.
Subhanallah. The reward of Allah is very great, because when it comes for salah, when it comes for reading the Quran, when it comes for charity, Allah doesn't say I'm with you. When it comes to sabr, Allah says, I'm with you. Inna Allaha ma'as sabirin. Because it's not easy. Sometimes we just tell a person, take it easy, brother, patience, we need to deal with it. People think, oh, this guy doesn't understand my problem. The guy probably thinking like, when you're in my shoes, then you understand what I'm going through.
And
it's for easy for you to say, but...
Absolutely. And therein is the other problem, because actually physical health, you will have a set of symptoms, and like if you go to the doctor and you say to the doctor, right, actually I've got a runny nose, sore throat, headache, they'll say to you 99% of the chance you've got a cold. You go to the doctor and say, two of you go to the doctor, and both of you say, right, actually I've got low mood, I'm feeling horrible, and this, that and the other. You both may describe something very similar, but actually the route to which that challenge has occurred in your lives is unique to you, and the path that it's taken is unique to you. Yeah?
Everybody is different, yeah.
So everyone is unique, and their understanding of pain, happiness, sadness, and the world around them is unique. So how they will manage that pain and what have you is unique to them. So it's, I suppose, in a complicated way, what I'm trying to say is one size doesn't fit all.
True.
So the aspirin or the paracetamol is not going to get rid of your mental health challenge as it would get rid of the cold. Yeah?
So mental health is very different to normal, anything else,
That's why it's very time. So when you go see a doctor, generally your GP will only see you 5-10 minutes. On average, the sessions with a psychologist or a therapist will last anything between 25, 35, 40, 45 to an hour and a half, depending on what therapeutic orientation you use and what have you. Because it's about understanding those dimensions and then understanding your, when I was speaking to some people, I always say, well, I'm incredibly nosy, so I'm being nosy in your world, basically. I'm a guest in your world. And whatever I say to you is always a hypothesis, it's a guess. It's not a fact. Because only you know what you feel. It's only between you and Allah.
So tell me this, so let's say example, if a person's giving you their opinion about their own world, and then you take their opinion, how do you differentiate that from fact, from what actually happened?
What is fact, though?
Whatever you perceive.
Exactly.
Yeah.
So
for them, their opinion is fact.
Yeah.
Oh, okay.
Yeah. So
fact could be their own fact then.
Yeah. So perspective is, how you see the world around you is unique to you. Yeah. So this is why, the Quran alludes to, and Maulana Sahib can give you more of a tafsir and knows more about this than I do, but the surah about time, is an example of how Allah subhanahu wa ta'ala is saying to you, actually everything is relative. You are at a loss because time is always
running out.
It's always going. Your perspective is always changing. There is nothing that is the only fact that you have in your life. Is that you are born, you have been given a gift of Iman, and it's whether you accept that.
So that could also mean that the feelings may remain with you, but the perception that you had when you had those feelings, those may change.
Exactly, over time. When I see people, and I'm conscious of time now actually, because I have to go, when I see people, they always say to me, or often they say to me, that I would like to be like how I was before the challenge. So when they come, they'll say, 6 months ago I was sleeping fine, I was eating fine, I was very happy, I was sociable, I was doing this, I was out and about, I was doing 6 months ago. Why can't I be like that? And I'm always saying to them, actually no, this is about the future, it's not about the past. It's about helping you grow into the person you need to be, not to go backwards. Because most people want to go backwards to the point that they are. But this is about helping you go forward. That you need to be in.
MashaAllah.
And with that, it's recognizing that the gifts that Allah subhanahu wa ta'ala gives you to enable you to
Allah brings these type of things in your life to get you on that. Subhanallah. It's just amazing. So, Brother Abdul Wajid,
So,
mashallah.
Unfortunately, Dr Abdul Wajid is leaving. Alhamdulillah, you very, very amazing. I'll just compliment, like, the talk I had with you was amazing. I'm so glad you came along. I'm very grateful that you came along.
Mashallah.
Opened my eyes to a lot of topics.
We've jumped quite a bit.
Yeah.
There's not been much of a structure, but it's a bit all over the bit. Alhamdulillah, I'm sure.
Yeah. Jazakallah khair. Thank you once again. Thank you, Maulana, for being here.
If anybody has any questions for Brother Abdul Wajid, or leave any comments, any experiences, any ideas, inshallah, share anything else, inshallah, until so we can take your suggestions on board, inshallah. Hope you benefit, and alhamdulillah, we've benefited a lot as well, mashallah.
Jazakallah.